All right, we got some knee flexion, pails and rails. I'm gonna sit into this stretch for at least 1 minute. As I sit into this stretch, I'm gonna move around a little bit so I can feel that sensation in different places, see what isn't strong, and just feel good. And I'm really gonna breathe. Make sure that I can get that knee and my quad to just totally relax. Okay, after you feel that stretch and everything is pretty relaxed, you're going to start to push now into the box. Obviously, you're pushing with your ankle and your foot, but you're creating that force with your knee and your quad. Start off with a low intensity and slowly build up to a 100% intensity, pushing as hard as you possibly can. That entire buildup should take you at least 30 seconds, but could go over a minute. I'm going to move my hip position and my knee bend angle as I push to see if I can get more stuff to push and respond. Now I'm going to go for that rails effort where I do the other direction, try to squeeze my hamstring and really squeeze the back of my knee, top of my calf, bottom of my hamstring, that region, as I try to bring my heel to my butt. And now I'm going to go for some lift offs as I try to tap the box and rep those out for 8 to 10 reps. Make sure you feel your entire hamstring. And then from there, we're going to go knee cars. So I'm going to squeeze, rotate my knee, squeeze, rotate my knee. As you can see, I'm doing tibial rotations, 8 to 10 reps going both directions. Those feel really good. Okay, we're gonna find a wall and we're gonna do some knee extension stuff. So you don't gotta get your leg super high. I want you to feel this in your knee, bottom of your quad. If your leg goes too high, it might be too quaddy. You might not be able to contract your knee. Find a place where you can feel that really well. And then you're just gonna lose a little bit of range, maybe like 3 inches, and then you're gonna extend again. So lose 3 inches, extend. Pretty much staying in a pretty challenging place here. We're gonna get about 10 to 15 reps, or I would just say until your knee is pretty fatigued and you can't really contract it any longer. Okay, make sure to do a rep on the other side if you're too tired to continue. But now we're gonna go back to the same side, and now I have tibial external rotation, same exact exercise, but as you can see, my knee or shin bone is going outward, right? So you should feel a little bit more outside of the knee, maybe outside of the hamstring stuff, and it's going to be a little bit different. Same exact rep scheme, same exact concept. And now I'm just going to go internal rotation, same thing. Really try to keep that rotation as you come down. It's going to be harder as you extend, but try to feel the inside of your knee squeezing as you get those little mini reps. Notice how much this is a full body exercise. I'm really trying to stay tall. As you can see, my left leg is staying firm. I'm not bending through my left knee. My hamstring is firm. I'm breathing. It's a full body thing. Okay, we got some knee cars. I got my medicine ball. I'm going to make sure I'm abducting, and we're just doing full range of motion of my knee. External, internal, bring it in, extend my knee, back out to external, bring it in. Really important that I'm squeezing my hamstring as I bend and thinking about my quad as I extend. So there's a lot going on here. I got my knee rotating. It's not a death grip on the medicine ball. It's more of a sensing of the inner thighs. All right, but I'm really trying to contract my hamstrings and make sure that I'm not using my hip at all. This is all tibial rotation. Fantastic work. And now I'm gonna go bonus exercise. We're gonna put a 15-pound kettlebell on our foot. Pretty heavy. If you have ankle weights that are about 10 pounds, those will do. But we're gonna work on mostly eccentric, but bonus points if you want to do the concentric as well, which is going up. But the biggest benefit here is when I start all the way up and I control that downward knee flexion. So essentially it's like a passive stretch because the weight's just taking me, but I'm controlling that as I go down. If you have the strength to go up, go for it. Just going to be a good strength exercise for your knee, but we're trying to control that downward part the best we can. Try to feel the knee doing all the work. All of this stuff is about conditioning tissue. So you need to listen to your body on how many reps you can do. I did 2 reps on each leg and I was pretty smoked. And then I went for another few reps on each side where I worked internal and external rotation of my tibia also going down. So as you can imagine, it's kind of like the standing up one we did before, but now I'm loaded and I'm working the rotation of the knee on that eccentric, aka absorption of the weight as well.